Young mothers, they face a lot of challenges so much in the community when it comes the time of deliverance.
Long distance of what? Where the hospitals are. It is also a big challenge. Eh? Then also, like time for giving birth, transport problems, moving, like it in case it happened at night, transport problem becomes very, very hard. That one also can affect the pregnant women.
Bamama abo ebiseera ebisinga batanya okufuna obuzibu katugambe nga balakinga nga mama kit abamu babeera balakinga pads wanga twebava wano nga batuse ekiseera ekyokola kyekyokuzaala ebintu ebibeera byetaagisibwa nnyo.
During my age, I gave birth without mama kit, but this is a time whereby every woman is running for mama kit.
No, long time people don't use to use it. They were just going where sometimes they used to deliver from home. You find that they use those clothes, rags. But now these mama kits are smart, are clean.
Mama kit is this provision where there are gloves.
Find soap, there's cotton, find
a polythene which they use to lay on the bed, they sleep on it. There's pamper after they use that. There's sometimes towel for carrying a kid after. There's a
pads, reusable pads. Those ones are after the blood has reduced, you can now use the reusable pads.
And there's those sheets for wrapping babies when they've just given birth. There's a razor blade. There's that thread for tying the umbilical cord.
To protect a mother. Okudifendinga mama n'omwana ezimu zibeeramu n'etawero erisiivinga omwana nga amaze okukola ki okuzaalibwa n'eggoozi naye abeeramu.
And ideally the hospitals are supposed to provide, the government is supposed to provide. But the government also gets overwhelmed. Needless to say that also the government workers sometimes sell the mama kits, which are supposed to be for free. They're sold. So you find that mothers lack what to use during the birth process, and many of them go to hospital without these. And the same health workers who sell, not all, there are some good health workers, but the same health workers who sell these mama kits won't touch the mother unless they have the mama kits.
Even if it is a government hospital, they tell you to buy it. Without it, they will not work on you. And when you don't have money, they will not attend to you.
You know, in our country these days, if you don't have money, there's nothing you can do.
So the lack of these mama kits, which is rampant now, is another challenge.
And it is for free. They have written on it, not for sale. But you find they are selling to them at 10,000, 5,000, very little is 5,000, but so much near. Most time I've gone, I find they are selling them at 10,000.
Actually, we always make a communication. Any woman who is ready and you are in your last trimester, please come from the mama kit from our programs here. And they always come. You find that they come from all over Tororo.
In the communities we reach out to, many women cannot afford those kits. They're really expensive for them to afford, and they must go with them to give birth.
Sometimes the men they get, for example, they get a young man, they are pregnant the lady, and the man cannot provide. So you find that sometimes they get a lot of challenges. So you find they cannot manage themselves to do what they want to do, even going to the hospital.
You find the mother is in hospital alone. If they're lucky, with an older child, an older daughter, or a sister, or a friend.
Manyi waliwo mama abamu abajanga mutagamba nti afe mu kalicha yafe omukyalo abeera nga azadde takirizibwa kutambula, takirizibwa kusala luguudo, takirizibwa kulya kino nga kale mukali kyo nga bagamba nti bakulanga kiri mu bwongo bwawe nti kiriwo ekiti.
These things of culture have killed many ladies. And people have died because of this kind of things of culture.
Ngezaako okubeera nga mbanyonyola nga mbagamba nti nedda ife mu science Katonda wayamba omukyala n'azaala bulungi n'ova mu ddwaliro bulungi, kiikirizibwa okutambula, kiikirizibwa okusala oluguudo, kiikirizibwa okulya eggi ly'oli kugaana nti ife mu kalicha yaffe tetulya ki? Tetulya eggi.
Me as a man, I've benefited a lot. It has really helped me and saved me. Looking at the economy of this country, you may expect and you don't get, more especially in the right time. You find that a woman is almost giving birth, you don't have anything in the pockets supporting the woman. But with this early preparation from Wanawake, really I thank God. It has really saved me.
Mbadde ekyo kiri ntukusaba kangambe nti okusaba singa kibadde kisoboka nga community ne tukumbanya ne tubeerako n'engeri gye tusobola kuteeka awamu obwongo, tusobola kubeera nga kufunayo akantu oba netusobola kufunayo akantu ng'akasente oba kaki ne kabeera nga kayambako disi yanga mothers, kubanga abasinga kituufu batera kufuna obuzibu naye nga tebabeera tebeesobola.
You get so used to having everything given to you here in this country that when you see another country where they have to bring all their own medical equipment, I think it's very important that they have that. Again, to go along with the health, you have to take care of the body before you can take care of the soul. So it's a shame that in some communities they are ostracized, but I do believe that it's important that we help them. God wants us to help all, and especially the outcasts. So if we can help the young mothers, we will be helping the children of those parents. And again, that will help the entire community and the entire country.
Right now, those who would like to support could give through Middletown Road Baptist Church, where I am the pastor. And in the future, we will be connected with a missions organization.